One morning, while watching TV, Mr. Sai, a 72-year-old gentleman, develops excruciating chest pain and has difficulty in breathing. His family doctor, Dr. Thomas, checks the ECG and confirms that Mr. Sai is having a heart attack, his third attack in the past 6 years. Dr. Thomas immediately contacts Dr. Raghu and tells about Mr. Sai's condition. Apparently, Mr. Sai also has chronic kidney disease for the past 5 years and is on dialysis for past 2 years. Dr. Raghu who tells Dr. Thomas to immediately shift Mr. Sai to Aster Prime. At Aster Prime, Mr. Sai undergoes angiography which shows 80% blockage in the left anterior descending artery. Dr. Raghu checks all the reports of Mr. Sai and suggests his special CHIP approach to save Mr. Sai. Coronary artery disease is usually treated by PCI or CABG, but these procedures may be complicated for certain high-risk patients. Such patients are then managed medically. For such high-risk patients, cardiologists at Aster Prime have started the CHIP program. CHIP angioplasty may be useful for elderly patients, patients with history of coexisting chronic conditions like kidney disease, stroke and diabetes, patients who have CAD in the left main or coronary bifurcations, or have total occlusion of the coronary arteries, patients who have had previous open heart surgery and advanced heart failure. Patients with worsening chest discomfort, excessive fatigue and dyspnea are considered high risk by cardiologists and are thus treated with medications. The advanced CHIP angioplasty techniques include rotational atherectomy, specialized antegrade and retrograde chronic total occlusion approaches, and complex bifurcation stenting. CHIP techniques have been shown to improve symptoms and quality of life of patients with high-risk coronary artery disease and lesser rates of readmission. Some patients with advanced heart failure or severe heart valve disease are very vulnerable during CHIP procedures due to weakened heart muscles. Aster Prime also offer catheter-based devices like IABP during CHIP to provide temporary support to hear. Mr. Sai's surgery was a success. He was stable and recovered well after the procedure. He was kept in the hospital under observation for 1 week, after which he was discharged. Dr. C. Raghu at Aster Prime Hospital is the best doctor to get your heart disease treated. At Aster Prime, we have a team of doctors with extensive experience in managing high-risk patients with coronary artery disease and facilities such as the Philips Cath Lab system, which is the best in the world, 24/7 cath labs and a highly skilled healthcare team. Be a part of such stories. If you feel that your patient requires cardiac interventions, refer them to us. The patients can reach us by calling us directly or through our website. If you need an instant opinion about your patient, you can reach us out through WhatsApp or Viber as well.